Hello everyone, it's Kayla, one of the exercise physiologists here at the program. Today we're going to go over resistance training and why it's such an integral component of your cardiac rehab exercise program. We'll first define what resistance training is. I'll talk about the many benefits. We'll go over the recommendations for how frequently you should be performing strength training. I'll also go over what core and functional training are, as these are popular subgroups of resistance training today. And then we'll talk about resistance training and how to incorporate that safely at home. So what is resistance training? It's when a muscle or muscle groups contract against external resistance or loads. It's of course intended to strengthen, tone, or increase muscle mass and or muscular endurance. And we can accomplish this with many different implements as pictured below. We can achieve strength training through use of dumbbells, kettlebells, free weights, even your own body weight, among others. So let's review the function of skeletal muscle. It's so important. It's the most abundant tissue in the body. We have 660 muscles. It's the only type of tissue in the body that can generate force. Obviously, it's the only reason why we can perform any type of movement, including locomotion. It's also helpful in maintaining our posture, body temperature, and it does actually provide some protection to our internal organs. Skeletal muscles are made up of cells or fibers, which are long and slender, and each of these fibers contain hundreds to thousands of rod-like strands that are called myofibrils, and these myofibrils are composed of contractile proteins. So when we talk about resistance training, it's important to note that there are 3 different types of muscle contractions. And the easiest way to go over this is just to use a simple biceps curl exercise as an example. When we take, say, a dumbbell and bend at our elbow, you can see that our biceps muscle is actually shortening while under tension. This is the lifting phase of the move, or the concentric contraction. On the lowering phase, when the muscle is returning to baseline and is actually lengthening under tension, this is called the eccentric or lowering phase of the move. There's also what we call isometric muscle contractions, where the muscle doesn't change length but is still under tension. Examples of this would be this gymnast here doing the iron cross on the rings, as well as this gentleman here holding out his beer stein. So why is it so important to incorporate resistance training into your weekly exercise program? I think this slide sums it up. It's going to help manage so many different chronic conditions. Some are listed in the right-hand column and I think are applicable to many of you. But the other image here does list a lot of other benefits, the most obvious being it's going to make you stronger, which can also help to strengthen your bones. It's going to help you burn calories, which will increase your metabolism and assist with weight loss. It can help to better control your blood sugars, blood pressure, and cholesterol. It can, of course, improve your cardiovascular fitness, as well as help to manage your pain, among several other benefits. So of course there's several benefits of resistance training, but I would like to hone in on a few specific benefits as they do relate to the aging population that we're treating here at Cardiac and Pulmonary Rehab. The first being sarcopenia. What the heck is that? It's the age-related loss of muscle mass. We expect a 3 to 5% loss in muscle mass each decade after the age of 30 among adults who are not physically active. And then after the age of 65, we expect to see muscle loss at even greater rates. So how do we quantify this in the clinic? How do we identify patients as having this issue? If you're losing muscle, you're likely going to be losing muscle strength as well. Often this is quantified by just a simple grip strength test where you squeeze a dynamometer very strongly, and there are cut points to determine whether or not you're weak. Low muscle quantity and quality is the second criteria, and the bottom right-hand image is a good example of how I can show this to you. This is actually what happens at the thigh muscle. On the left side, we're looking at a young, healthy thigh, and on the right, we're looking at a thigh in somebody who has sarcopenia. You can see that the circumference of the thigh is actually much smaller than the one on the left. We're also seeing a lot less white surface area. The white is actually muscle. Also, we're looking at a lot more black surface area in the right-hand image. The black actually depicts fat. So you can see that fat is infiltrating the muscle tissue itself, and we're seeing a lot more fat under the surface of the skin. So if you're losing your strength and your muscle quality, your physical performance is obviously going to be affected. Your lower body isn't going to perform like it did when you were 30. You might be a little bit slow in moving around with your gait, and you're going to have a lot more difficulty using your lower extremities to perform tasks like stair climbing and even just simply sitting and standing from a chair. So this contributes to frailty. If you're frail and you've lost your strength, you're probably not moving around as well as you used to. You're putting yourself at greater risks of falls because of your frailty. And if you fall, you're probably going to be more susceptible to fracture, which leads us into having a conversation about our next issue. Osteoporosis is common among aging adults as well. Osteoporosis, which you're probably familiar with, is the loss of bone mass. We know that bone mineral density peaks at the age of 30 and declines with age among both genders. We can expect to see a significant loss in bone mass in women after they've reached menopause because of the drop in estrogen. When I draw your attention to the bottom right image, we're talking about two different types of cells within the bone, one being the osteoclast and the other being the osteoblast. Osteoclasts disrupt old bone tissue, and osteoblasts have the function to actually produce and lay down new bone. When somebody has osteoporosis, the production of the two aren't equal as we'd like them to be, so we're actually laying down a lot less bone and breaking down bone at a greater rate than we should. This leads to your bones becoming more brittle and more prone to fracture. Performing regular resistance training is going to obviously make you stronger, but it's also going to help improve your ability to perform activities of daily living, like carrying groceries, making the bed, climbing stairs, and even vacuuming. And if you're performing your activities of daily living with ease, you're likely going to be maintaining your independence and not having to rely on family members or hired help to perform these activities. We know that resistance training is also going to help improve balance, coordination, and mobility. This is going to make moving around and walking a bit easier, and it's going to affect your fall risk. If you can move around a little bit easier, you can catch yourself if you lose your balance and you're not grabbing hold of objects to steady yourself, you're at less risk of falling down. Resistance training also helps to improve posture. When we look at the top right image, it's a good example of what happens to our posture with age. We tend to have a forward head posture, a rounded back. We start to see the trunk falling forward, which is defined as kyphosis. Strengthening all the muscles in your back will actually help to keep you upright and maintain perfect posture. We also can expect that resistance training will reduce joint pain and stiffness associated with arthritis. If you sit down and do nothing, your joints are just going to be more stiff and contribute to more pain and inflammation. Resistance training can also help to address weaknesses that develop from previous injuries. You can see the gentleman on the bottom right has quite a bit of droop in his right shoulder. He had a lot of atrophy and muscle loss, probably from a dislocated shoulder, and then probably after some physical therapy and some strengthening, that resolved. So you can see that that helped to correct his muscle balance from his previous injury, but these things can happen over time and can simply be corrected with performing regular resistance exercise. So how often are we supposed to be doing resistance training? The American College of Sports Medicine and Center for Disease Control and Prevention recommend that along with your 150 minutes of moderate intensity aerobic exercise, you should be performing weight training at least twice per week. You should always make sure that you're targeting all the major muscle groups as highlighted in all the pretty colors on the right-hand side. So over the course of the 2 times per week strength training sessions, you want to make sure that you rest in between sessions to allow your body to recover. Just like your cardiovascular exercise, intensity should be perceived as light to moderate. We generally start our older adult patients with 10 to 15 repetitions, and somewhere between 2 and 3 sets, with some rest periods in between sets. And we favor multi-joint exercises over single joint exercises like that biceps curl. And we'll talk a little bit more about why when we begin to talk about core and functional training in later slides. So to continue on with recommendations, just like with your cardiovascular exercise, it's so important to perform an adequate warm-up. Dynamic warm-ups, where we're actively moving through large range of motion activities, just like the athletes do on the field to prepare for their sport, are going to be most beneficial. Warm-up helps to increase your core temperature, gradually helps to increase your heart rate, and ultimately will prevent injury from occurring. We want to think about performing all of the large muscle mass exercises before the small muscle mass exercises. To put it simply, the harder activities come first and the easier will come later on in the program. It's important that we train all the major muscle groups symmetrically and as evenly as possible. We never want to hold our breath during weight training while pressing against loads, and we really want to avoid the Valsalva maneuver, again, classic breath holding in Olympic style and powerlifting when folks try to lift insane amounts of weight and hold their breath to be successful. This causes dramatic increase in blood pressure, and I'm sure you've seen several gym fail videos where folks try to deadlift, 500 pounds holding their breath and then they pass out. So, always a good idea to exhale on the effort. Also, extremely important to start with light weight. We want to think about adding sets, then repetitions, before we even think about increasing the weight. So again, you should perceive the effort as light to moderate with a rating of perceived exertion from 2 to 4 out of 10. Start with 1 set, add the second set, and then maybe even the third set, with each set 10 to 15 repetitions. It's always important to practice perfect technique, quality, always greater than quantity. If it hurts, don't do it. No pain, no gain is not a philosophy that we want to hold here at Cardiac Rehab. We can always modify an exercise so that it's pain-free. And again, just like with your cardiac rehab, cardiovascular exercise, it's important to cool down, not only to help lower your heart rate back down to resting, but to help you recover in between sessions. We do this with static stretching, where we hold a stretch for about 20 to 30 seconds. And again, with regards to recovery, we want to make sure that you have 1 to 2 days of rest in between strength training sessions. So what the heck is core training? Core training is defined as strengthening the muscles of the pelvis, lower back, hips, and abdomen. These core muscles help to stabilize your trunk and spine, which contribute specifically to balance, posture, and injury prevention. Then when we begin to talk about functional training is the development of strength, stability, and mobility that is required to perform daily tasks, recreational activities, and sports. We talk about specificity of training here, where we're performing exercises that translate to specific activities or tasks. Functional training is always going to place emphasis on core stability or core strength, as highlighted in the last slide. And overall, our goal is to improve the body's efficiency to work as one unit. Functional training type exercises are squatting, lunging, any tasks that require pushing and pulling, bending, twisting, and even just simply walking. So the one example I could come up with here that highlights specificity of training is Tuukka Rask, goaltender for the Boston Bruins, reaching out and almost putting himself into a split here to save the puck from going into the goal. How the heck does he get ready for that? You see him in his training studio performing a very similar movement, which is called a lateral lunge, to help strengthen the hips and improve the inner thigh and groin flexibility as his job requires him during his game. So when we start to think about resistance training at home, you want to make sure that you wait until your case manager creates an individualized plan that will help you achieve your goals. We generally start strength training at about week 3 or 4 in your program. You'll be oriented to proper technique before your assigned home exercises. We have a lot of different handouts available that I've created, as well as video demonstrations of these handouts on our YouTube channel, which is Miriam Hospital Center for Cardiac Fitness, and more videos will be posted soon. When you think about purchasing equipment, there's a lot of different retailers that have a lot of different implements, including hand weights, resistance tubing and therabands, resistance loops, stability balls, kettlebells, or even, yoga and floor mats. You want to talk to your case manager about the equipment that is right for you, and then look at the retailers that I have listed to the right here, including Amazon, Dick's Sporting Goods, and Perform Better, which is a local and national manufacturer of fitness equipment. So our key takeaways here: 1, resistance training improves muscle mass, strength, and endurance, and it addresses several age-related disorders, including sarcopenia, osteoporosis, postural deviations, and joint pain from arthritis. And our last and final point is that everyone should resistance train all major muscle groups twice per week with 1 to 2 days of rest in between sessions. That concludes my presentation. I hope I provided some clarification as to why we do incorporate resistance training. If you have any specific questions, you can go ahead and reach out to me, but more importantly, speak to your case manager on how you can safely implement this as part of your rehab plan. Thank you. Have a good day.